everybody. This is Carol Maletta. Welcome to the Parenting 411 podcast, where we share information parents need from sources they can trust. If brushing battles have become part of your nightly routine with your kids, it's time to make smiles happen the easy way. The Oral-B Kids Electric Toothbrush turns brushing into fun with gentle, dentist-inspired cleaning power designed just for little mouths. With soft bristles, a built-in timer, and kid-favorite themes like Disney princesses, Frozen, and Pixar Mandalorian, it's the brush they'll actually want to use. Plus, it connects to the Disney Magic Timer app, which rewards your kids for brushing the full 2 minutes. Ready to make happy brushing a reality in your house? Just click the link and grab this deal by Oral-B today. All right, today I'm going to talk about something that I know is really important to you, and that's your children's health and what you can do to help them stay healthy, whether it's just a regular day, or it's one of those times when you have to visit the doctor or, wow, maybe even the emergency room occasionally. I think all of us have been there a time or two. And so thankfully, I have Lydia Molinara joining me today here at the Parenting 411 podcast. She has more than 30 years as a pharmacist and a patient safety officer. And as the founder of Mom's Healthcare Navigator, she equips mothers and caregivers with the confidence and the tools to step into healthcare conversations for the sake of their children. Now, her method, advocate, communicate, and educate, turns what often feels overwhelming into practical actions that can prevent errors, improve outcomes, and just give you peace of mind. In this episode, we're going to dive into how you can ensure that you are administering medications correctly, that they are safe for your child, and that you can access the right care for your child so that you can become a bold, informed partner in your child's health journey rather than a bystander. So with that, let's get started. Welcome, Lydia.
Well, thanks so much for having me. This sounds like it's going to be a lot of fun. I love talking about this, so it's great.
Yes. And as a mom of twin sons, they are now young adults, but I certainly would have loved to have a healthcare navigator with me as I was traveling those challenging waters. But you have had, as I mentioned, a long career as a pharmacist and a patient safety officer. Tell me about that, first of all, before we go in. What is a patient safety officer?
So my years in being a pharmacist, I owned and operated pharmacies, and I was the front person, basically making sure that the operations that we were running were going to be safe. We did a lot of work outside of the pharmacy. So we went to shelters, mental health, and addiction programs. We did long-term care programs. We did assisted living programs. And I worked frontline as a pharmacist standing at the counter. So my experience was always about making sure that we didn't make errors, because errors in pharmacy with medications can be deadly. And a lot of what I learned was there's certain operations, certain pathways that you want to try and prevent errors from happening. So I dived into really learning and understanding that. And that's when I became a certified patient safety officer and really looked at all the different ways of healthcare pressures where we as healthcare professionals, there are certain red flag areas where we, under those circumstances and in that environment, can make errors. And so that's what really the exploratory and the education taught me, is in those red flag areas, how we as healthcare professionals and implement things to prevent errors. And on the flip side, through all of that, of course, I learned as a patient the red flag areas that you need to do so that you learn your look both ways before you cross the road, so you stay safe in these environments as well. And so that's really all of that experience and all of those discussions that I had. And, with my, on Instagram, sometimes I'll post something and then I get the DM messages and people are like, I never knew I could ask that question, or I didn't know I could actually say that. So there is still, when you think about it, we learn, when you have a child, you need to know first aid. You should know 100% what to do when they're choking. And I totally agree with that. Trust me. But we don't get taught, well, how do I communicate with the pediatrician? How do I ask the right questions? We see so much in social media and so many people telling us things. And it's like, well, how do I decipher what's right for
That's
my
right.
child, right? What's right for my environment? And that's the critical thing. Every person has their risk versus benefit to that treatment because we're not all alike. What might work for you might not work for me. So if I don't have seizures, so taking a seizure drug for me could potentially really harm me. But if I did have seizures and I took the medication, that's a huge benefit for me. So no two people are alike. Your children aren't alike. When you have to decide for one child versus another child, that's why learning the basic conversations and what to track. I always say you have to know what to ask, what to track, and what to follow up on. Those are your three things. And the ACE principle is sort of how I try and communicate that as best as I can.
Well, we'll get into that in a moment.
Yeah,
I want to first of all point out, and you alluded to it, that you have had a personal experience too, that also, in addition to your expertise, really commits you to this mission of giving parents this valuable information. Talk about that.
Sure. When my daughter was 9 months old, she ended up spiking a massively high fever. And at this point in my life, I was doing shifts like crazy at the drugstore because there was a shortage of pharmacists. Like I'm talking 9 a.m. to 11 p.m., 5, 6, 7, 8, 9 days in a row. So I'd come home, you're tired. My caregiver was looking after my daughter. She says, she's had a high fever. I've tried. I can't get this down. And this is on the 5th day. And I looked at her and went, something is wrong. Like something's just wrong. This isn't a cold. She's got no other symptoms. So I take her to Emerge, and in Emerge, they're saying to me, well, it's probably just viral. And I was like, you know what? I don't think it is because she's got nothing else. So I would like to stay and have her observed. And then I said, and I'd also like to do a urine test. Now, of course, that for me was my education at the time. That prompted me to ask the question. Turns out she had a urinary tract infection, but the basic part to the whole story was, one, I advocated to stay and asked for that because of my knowledge. But what you would be able to do if you didn't ask for that, you would say, well, what are the other causes that could make her have a high fever for 5 days? What other things should we look at? Because she's not experiencing and showing any symptoms of flu. So she doesn't have anything else, no runny nose, no headache. There's nothing else going on with this baby. So that would be your cue to ask, what is the differential diagnosis? Those two words. So having said that, we find out that she does have a urinary tract infection. The pediatric resident comes in, and I'm sure that she hasn't slept in days, and she starts to calculate the dose. Again, me being a pharmacist, I'm sitting there and I'm like, I calculated these doses when I was in school. I know this. And I said, I just froze because I was like, I think that's too high. And this particular drug can cause, hearing loss, kidney damage, and or death. Like if it's
so scary because the average parent sitting in there does not have that expertise at all, and they just believe that a doctor just knows what they're saying and knows what they're doing and trust that. So what did you do?
So in this particular situation, I'm also not sleeping and I'm tired and all of those things and fearful and anxiety ridden. So I just simply said, how did you calculate the dose? I wasn't challenging. I didn't, she didn't know I was a pharmacist. I just asked her, how'd you calculate the dose? And so when she went through explaining how she calculated the dose, she herself realized that the dose was too high. Okay. So what I'm going to suggest is if you're in that situation, and remember, this was almost 20 some years ago. Now we have the luxury of having our iPhone. We can look up if a doctor says, oh, I'm going to put your daughter on this medication. You can look it up and see what the usual normal range is. That's the gift of sometimes some of these pieces of technology. So you can look it up. And in fact, you should be looking it up. And so you would see, oh, well, that seems high. How did you calculate the dose? I just looked and it seems to say the normal average is this. The answer might be, yes, that's correct. But for this particular disease state or what we're trying to treat, we do have to go a little higher. You'll find that. It'll tell you that as well, right?
Right,
So
right.
you'll know, okay, you double checked, everything is okay. Because we have to keep in mind on the flip side that as a healthcare professional, you're in a situation where you're seeing maybe 20, 30 people, you're running on fuels like fuel. You don't have fumes, sorry. You don't have all this time to just sit there and calculate and 20 hours later you've got this all. No, it's high paced, it's high speed, you got to make quick decisions. So we as healthcare professionals, and I'm going to say the most brilliant neurologists, the most brilliant anesthesiologists can still make a mistake because we're human. We still
Right,
can make mistakes in
right,
calculation.
right.
So when we talk about trying to make sure that you insert yourself, this is exactly what I mean. When
Mm-hmm.
I recognized that that almost was going to harm my daughter, I sat there for a minute and I remember holding her and thinking, this must be a reason why I became a pharmacist. But then I sat there and I thought, what about all the other moms who aren't pharmacists?
Mm-hmm.
What about all the other moms who don't know this? And that's
Yes.
where, my career has taken me all throughout that. I've always had the lens of being that mom with that child coming to the counter and asking about the medication and what this medication can do and how does it help or harm or what can we do to make my child feel better. And so
Mm-hmm.
that was always my perspective because I lived it. I walked through those shoes. And I think it's really important to understand that we do make a difference. We have to trust our instincts. I had a feeling something wasn't right despite me
Mm-hmm.
being tired. Yes, it was my education, but the feeling that I got when it was like,
Mm-hmm.
that doesn't seem right. I
Right.
had to trust it and I had to advocate it. And because I did, she wasn't harmed. And so that's what I think is really important for parents to trust that instinct because it always leads you down the right path. It is
Mm-hmm.
instinctual.
I like that a lot. And I can remember a doctor that I took my son to. He said, Mom, you're the expert. I'm not going to argue. I'm not going to argue with you. Let's take a look at this again. And so I definitely appreciated that respect that he showed me. Sometimes it's not the case because doctors may feel challenged. Like, why are you asking questions when I've studied for years, I've worked in this field for years. You haven't. Why can't you trust me? So you have a model, the ACE method, which I think will actually help parents feel a little more comfortable, even though they're going to have a difficult conversation. They sort of know where they're going. They sort of have a game plan. So talk about your ACE method.
Well, I think it's really important to look at this like, we do get intimidated. Healthcare is a totally different language, and we
Mhm,
don't have all those 12, 14, 18 years of experience, and
mhm,
knowledge and school that a physician does. But I'm going to take it back to the point that nobody knows your body and nobody knows your child better than you. You
mhm,
know what they behave like on a normal basis when they're not ill. And then when you see something that's not right, you know it. So with
mhm,
the ACE method, the A part is the advocate piece. It's about explaining this, removing your fears and your
mhm,
barriers that
mhm,
allow you not to speak up because speaking up doesn't need to be aggressive. It's a conversation. And I
mhm,
often kind of compare it like if you were renovating your kitchen and you and the contractor had a plan and said, "Oh, I'm going to have, wood cabinets." And then they
mhm.
come in and they're white. You're going to say, "Wait a minute, that's not what I don't think that's right."
Right.
You don't have fear to tell your contractor that's not right. So I want
Mhm,
I want that removed from the mindset that because it's a healthcare professional, you're not allowed to speak up because that is exactly what's going to protect you. Because healthcare professionals, like the contractor, needs to know that doesn't seem right. This isn't exactly correct.
mhm,
When a nurse comes in and provides a medication by the hospital bed, you ask, "Oh, what medication are you providing?" There's nothing wrong in doing that. It's a double check for the nurse as well to
mhm.
say, "Oh, I'm here to give 300 milligrams of Tylenol." And you can say, "Oh, no, my child only weighs 20 pounds. That's too high."
Right.
There's these things where those inserting yourself in those conversations is the
Mm-hmm.
advocate piece and very important because what it is you become the active participant, as you
Mm-hmm.
alluded to. That's what
Mm-hmm.
helps.
Mm-hmm.
The C part is communication, which isn't just about language, but it's about tracking and
Mm-hmm.
providing the information in a clear, concise, and truthful manner. And what I
Mm-hmm.
mean by that is if you haven't been giving or taking the medication exactly as prescribed, you need to be truthful with that
Yes.
because that's going to affect how the treatment plan around that is going to be. So if someone says to you, well, have you been doing this? And you say, no, I haven't, because that medication has caused my child to vomit every night. So I stopped it. You
Mm-hmm.
need to be truthful so that you get a proper care plan
Mm-hmm.
surrounding what those signs and symptoms are. And again, with the advent of our phones, video things that aren't right, because you know what kids do many times they'll go to emerge and they don't behave the same way that they did when you were at home or to the doctor. It's like,
Right.
is your throat hurting? And they'll say, no, I'm good. And then you go home at night and their throat hurts.
Right.
So,
Mm-hmm.
so video the pain that they're experiencing because although it seems like, why would I video my child if they're in pain? It's because you want to capture that so
You're
that you can
right.
show it and explain it and say, this is what happened last night,
Mm-hmm.
just so that the physician or the pediatrician or the emerge doc or the triage nurse can see what you're trying to explain. A picture
Mm-hmm.
is worth 1,000 words. Same thing. That really helps. And then the E part is educate yourself, double check the doses, look at
Mm-hmm.
the different signs and symptoms. I wouldn't rely 100% on everything that you find in ChatGPT or Google, but it raises questions, right? So
Mm-hmm.
take those questions and then start the cycle all over again. Do your advocacy, your communication, your education. And once you understand the treatment plan, write it down. So part of the communication and education piece is write down your questions, write down those answers, and continue to write down the treatment plan. So if it is your child has strep throat, it's been
Mm-hmm.
confirmed, this is the medication, you take it 3 times a day, like this, da 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 da. You write those things down because when we get home and it's stress and it's anxiety and your brain isn't 100% focused, you're going to say, oh my gosh, was it what? What was it? Because in the moment, you
Mm-hmm.
think you heard everything.
Yes.
Right. And then
Yes.
when you get home, you're just sort of now your brain is starting to relax because you feel like, okay, we got this. We know what's happening. We know what to do. And then you think to yourself, oh, did they say shake it or not shake it? I can't remember. Oh, I forgot to ask this. That's
Mm-hmm.
when you then, if you have it written down and your questions ahead of time, you can track those things. And then if you
Mm-hmm.
still have questions, you pick up the phone and you ask those
Mm-hmm.
questions, whether that be to the pharmacist or you call back the doctor's office. So that cycle helps
Mm-hmm.
you navigate because healthcare is like water, it comes and flows. And so
Mm-hmm.
navigating those seas is the same thing. You have to continuously look at the treatment plan, change the treatment plan,
Mm-hmm.
continue to tweak it. And if you have a child that has a condition that isn't short lived, but more long term, you're going to
Sure.
continually come in and out of these cycles. And
Right.
so by using those 3 methods, speaking up, being an active participant, tracking things, writing down your questions, and researching and continuously asking the questions and understanding the treatment plan, checking in on the treatment plan, seeing how it's going, you're going to get a much
Mm-hmm.
better experience and a safer one as well.
Mom, you know that helpless feeling when your little one's cough just won't quit? Well, Children's Mucinex for cough and chest congestion is here to help. It's got just the right ingredients to gently break up that mucus and calm chest congestion. It also thins and loosens mucus so that you can quiet that nagging cough and your child can rest well. Plus, it comes in kid-friendly flavors like berry and orange cream, so getting relief is actually easy. Use this link to grab yours at Walgreens so you are ready for cold and flu season. Just click the link below and snag this deal today. Lots of good tips there. I mean, writing things down. And also, it was key. We have these phones, so you can take the picture. That is a really good idea. I hadn't thought about that. And also, what was interesting was that you didn't totally discourage us from Googling or looking things up, but not taking it as using it to guide our thinking, but not taking it as a substitute for doctor's advice. Because I can remember I've been to doctor's offices before and I'm asking questions. I'm like, well, I looked up and I found and and sometimes the doctors say, okay, enough Google University. But it's not, we can't throw it all out. It may not be 100% the answer, but it certainly does give you a little bit of a foundation to have a conversation with a professional. So
Absolutely.
I definitely like that. And so, as you said, you mentioned some mistakes that parents might make with it, just not quite remembering the dosage, not maybe remembering whether food should be maybe served with it, or whether it can be what time of day, how much, all of those things. Are there any other kinds of common mistakes that parents might make in terms of administering the medications
Well,
that are common that you see?
yeah, the red flag areas. So you really want to make sure that you track the doses that you're giving because oftentimes like, and I do this with vitamins at my age
Mm.
did I take it today? Did I? So I just, when I have I give my child vitamins and I take some vitamins. And so when I take it, I just have a little like calendar and I just put a check mark and I'm like, oh yeah, I did it today
Oh,
already. Cause
gee.
sometimes
Okay.
that's just a simple little way to do it. It's right by the medicine cabinet and I just put a little check mark and it's just a little calendar and you wipe it off, and every month you just put a check mark on the day and away you go. So, tracking your medications is important. The other thing is if you have multiple caregivers, if you leave in the morning and someone else, like your partner, is giving the medication later in the
Mm.
day, you want to make sure that you track the times. If
Mm-hmm.
it's where a child is acutely ill and you're giving them some pain reliever or fever reducer, you want to make sure you track that it's every 4 hours, every 6 to 8 hours so that you don't forget, especially if you give something in the middle of the night. You're like, oh gosh, what time did I give that? Just even if it's in your phone or write it down beside on a sheet of paper, the times that you gave it when they're acutely ill, put it on the fridge. So it's really important to track your dosing times and that you've
Mm-hmm.
provided the medication. Keep everything up high and locked away. Don't mix your medication with your children's medication. Keep
Good
adults and
point.
children's medication separate. So when you have your medicine cabinet, keep them separate. There was an instance where a lady's 12-year-old boy didn't take his medication. He took his mother's high blood pressure medications.
Oh,
School called,
I've
right?
heard of that too. Mm-hmm.
School calls, the mom is not, what's going on, realizes when she goes that the cap for her medication wasn't
Oh,
quite put on, and
wow.
she's, having to rush her child to emerge. So it's important to do that. The other thing is in the middle of the night, if you're fumbling around and you're trying to look for a pain reliever medication, you won't grab the wrong strength of
True.
Tylenol per se. So I always separate children's medications from adult medications, but still locked and up high. And the other thing is really important to know is exactly those 5W things. Why is this medication being prescribed? How does it work? So again, you mentioned, should you eat it with food? Is it on empty stomach? Is it separated by vitamins? So you've got to explain which medications you're taking because there are, if your child needs iron, they shouldn't be having calcium with it. Well, calcium is in multivitamins, calcium's in milk, calcium's in cheese, right? So you've got to make sure that you separate some foods and any other vitamins that you're taking away from it by 1 or 2 hours. So you got to ask, based on what I'm doing, how does this medication fit in? And then you want to know, like, how long does this need to be taken for? Some medications are short lived. Some
Right.
medications have to be taken till they're done. And then the other question that you have to ask is, what happens if the side effect occurs and this
Mm.
I can't it doesn't work for my child. I can't keep giving it. They have really bad diarrhea or they
Mm-hmm.
have really bad vomiting or they get a rash. What do I do? Who do I
Mm-hmm.
call? So
Right.
you want to have those questions because the treatment plan is set, but it doesn't mean it's going to follow it exactly, right?
Right.
So it's the same thing when you're talking about going to emerge. If, let's say, for my daughter, if I went home, I would have asked the question, okay, if this is just the flu, when will I expect her to get better and why should I come back? so that you
Mm-hmm.
have an understanding of those two things. And it's the same thing with the medication. When should this start to get better? And when do I get concerned if it doesn't? What are some of the red flags of why things aren't progressing well? That means that it's not actually, an infection. Something else is going on. So you want
Right.
to make sure that you understand that part of the treatment plan. And then when you're picking up medication, if it's a refill medication, if your child has something that they're chronically taking medication for, you
Mm-hmm.
want to make sure it looks the same because there are drug shortages. Sometimes we use one brand versus another brand. The tablet looks a little different. You need to look that up. So we talk about Google. This is one of those instances where you look that up. You look at the name of the brand on the label and you
Right.
want to Google that and you want to see that those tablets match. I had a
Mm-hmm.
situation where one of the dads came in and said, "This tablet looks different. I just picked it up. I was at the doctor. I went into the pharmacy that was
Mm-hmm.
closed. They're closed. Please tell me, is this the right medication?" And it wasn't. And so I said,
Wow.
"No, this is not this. No, this is a different drug." So the label got put on the wrong vial. These are common
Ooh.
errors. So
Wow.
double checking, even the first dose that you get, you want to make sure, okay, it's supposed to be a Moxil 250. That's a yellow. I'm making this up because I can't
Sure.
remember, but it's a
Sure.
yellow and red capsule. So
Right.
then, okay, yep, it's a yellow and red capsule. I'm good. So you want to double check those things. And with compounded medications, because
Mm-hmm.
sometimes children can't take large tablets, they're compounded. You want to understand what is the consistency of that liquid supposed to look like? What color is it? What does it taste like? And so you
So with
can pick.
compounding, it's that they have to formulate, they make a formulation right there at the pharmacy.
Exactly. So we'll
Okay.
take a tablet, we'll crush it,
Mm-hmm.
we'll put it in a liquid, some kind of, simple syrup or something. You want
Mm-hmm.
to make sure that you taste it, that you know what the consistency should look like. It's clear, it's cloudy, you have to shake it. You want to understand that right from the beginning. And then every refill after that, you want
Should
to
look
taste
like
it.
that.
And you want to
Mm-hmm.
taste it to make sure it doesn't taste anything different.
Hadn't thought
Unfortunately,
about tasting it. That's
yeah.
interesting. Mm-hmm.
Because if it's not very same drug, it will taste different.
Wow. Wow. So, in this age of technology, we have telehealth and even AI. How has that changed the way parents interact with healthcare? And do you think it's for the better or do you think it's for the worse?
Well, telehealth is accessibility. So
Okay.
I think that's a really good thing
Okay.
in the world of healthcare, where we
Mm-hmm.
can get on a phone call with a physician for 15 minutes rather than dragging our child out of the house and away we go. The thing with it is you have to remember there's limitations. The physician can't check the chest, can't see the ears, can't look in the eyes. So if it's an appointment where the child needs to be, looked at and there needs to be a physical connection, then telehealth can, at least at the very least, when you present the child, the physician can say, okay, that doesn't look right. You need to come in. So you have that as a guide.
Mm-hmm.
I think it's really good for things like in the treatment plan, okay, my child has been getting better, but look, I still see that this is happening. The doctor can see that. So it's an accessibility feature that I think is good because
Mm-hmm.
rather than, having to go or drive or do this, at least you have access.
Mm-hmm.
As far as AI is concerned, like I said, if you're going to Google or Chat GPT something, you can't take that as the, be all and end all, but it can give you some ideas. If you put the signs and symptoms in, it can sort of help guide you. It could be these 5 things. So then you could sort of make an assessment and say, well, those 5 things, if it's saying this is an emergency, you need to go to the hospital right away, you can make that assessment and say to yourself, you know what? I actually think that's right. If your child has pain in the stomach and then it's going to the right, side of the stomach and you're thinking, what could that be? And you're looking it up and my child has nothing but a high fever and has pain on the right side, probably will come up and say this could be appendicitis and it's an emergency. So then you might say to yourself, well, it's not going away. They've gone to the bathroom. They've done, all these other things that suggested.
Mm-hmm.
That's clear. So I think I might take them and check out and make sure it's not appendicitis. So I think it can be used as a guide. And
Okay.
when you're speaking with the physician, as you said, don't necessarily have to say, oh, I Googled all this and I checked it. I would just say, I researched some of this. I don't know. I just want to ask, can it be any of these things?
Right.
Because the other thing you don't want to do as a parent is go in and be like, I think it's this, because
Right.
you might miss many things that it might not be. And so you
True.
still want to go with the signs, the symptoms, the pictures, tracking things. You don't want to pigeon nose your diagnosis and only go in one direction, because you're
Good
going to
point.
miss other signs and symptoms that are going on. You just want to have a very open mind and discuss things openly with the physician.
Mm-hmm. Mm-hmm. And another debate when talking about healthcare is just the reality that it's not healthcare access isn't the same for everybody. So, what advice do you have for moms who are navigating cost barriers, dealing with insurance? There could also be some language or cultural differences that sort of stand in the way of them getting access to good healthcare for their children.
Well, I know that, healthcare in every country has its good and bad in the sense, dealing
Hmm.
in Canada, there's massive wait times in many different hospitals across the country. And when you look at
Hmm.
an emergency department, but then when you look in the US, the insurance companies will deny claims, not pay for things. The hospitals are expensive. If you don't have insurance, where do you go? How do you access things? Good news is there is a lot of information that and not for profits that help with your hospital bills. My advice is always to make sure that when you have insurance,
Hmm.
you know and understand your policy inside and out and what you can access and not access. Because
Hmm.
what sometimes happens is in an emergency, you're going to go to the nearest care clinic, let's say.
Hmm.
You're not necessarily going to go to the hospital within your managed care insurance portfolio. But when
Mhm.
you do that, you have to understand that if you get an x-ray, it's going to cost you $1,200. But if you went to the hospital, the x-ray
Mhm.
costs $20. So
Okay.
you really want to know your insurance plan ahead of time if you have
Good point.
insurance.
Mhm.
If you don't have insurance, understand that hospitals do have not for profit agencies that can help with those hospital bills. There are many, many different associations and agencies that can help. And sometimes people get overwhelmed with huge hospital bills. The
Mhm.
hospitals themselves also have programs that you can ask and apply for to get the bill reduced. And most
Mhm.
people don't know that because it's not advertised.
That's what I was thinking as you were talking about
Right?
it.
It's not that hospitals advertise that they have these programs, but they do. And you can ask for a patient advocate and or a social worker at the hospital to help
Mhm.
navigate those bills too. I think it's really important to also remember that in your community, pharmacists are a great resource. We can help to guide you on different ways to help treat things. I have many colleagues that work in the US, and they say, some nights it's like being in the emergency department, but at the pharmacy, because people don't have coverage and they don't go to the hospital, they go to the pharmacy for answers and care. And so pharmacists are frontline and we are very accessible. Many pharmacies 24 hours a day. So ask to speak to your pharmacist if you need help trying to even understand what to do and where to go with this. And that also is a great resource.
I agree with you. I've had very good experiences with pharmacists really clearing up misunderstandings, both in person and over the phone. So I'm really grateful for that. Now, as we wrap up, could you offer just one powerful step every mom can take to protect their children from healthcare harm?
Absolutely. Be active participant. Bring a note, book, and a piece of paper to
Mhm.
every encounter you go to. Write things down, grab a healthcare journal. Make sure that you know what is happening with your child. You ask the questions and you become actively involved. Being actively involved and an active participant in your own and in your child's healthcare can reduce errors by up to 50% that are preventable. So
Mhm.
being active is number one. And we do this with many different things, but in healthcare, it is of utmost importance.
Mhm. I've even discovered I hadn't seen them before, but these sort of healthcare books, journals, healthcare journals. that I even purchased one for myself. I said, because maybe I need to start making a note of these things so that, as I get older and, my children might need to know what my doctor's appointments, whatever medications and things like that. And I wished I'd been keeping something like that all the time. But when they were younger, I definitely had all of their forms and things in one place, but a book is really handy. And it's, as you said, you can take it to your appointments. It's just very easy for you to keep track of things in one place.
Exactly. Yes.
Yes. So how can we follow you? You mentioned Instagram and wherever else. Where can people learn more about what you do?
My website is momshealthcarenavigator.com. I'm actually, when we talk about a journal, ironically enough, I just finished writing mine because I was like,
Okay.
I've got to write these things out. And also, what I've done is the top questions to ask. So when you are at the doctor's
That's
office,
good.
it's a segregated way to ask the questions and how to write and record the signs and symptoms. But
Hmm.
on my website, I have free resources. So I have an ebook and a course, but I'm also going to be adding that journal. And then on Instagram, I'm at Mom's Healthcare Navigator, on TikTok at Mom's Healthcare Navigator, and as well as on YouTube. So I'm in all of those spots, but I really feel that if you just take that extra 10, 15 minutes before you even go into the hospital, go into the doctor's office and record and write down, keep track of things, bring in an extra pair of eyes and ears with you, bring someone to help you to rely on. These are the things that are going to make you feel confident in navigating healthcare.
Yes. Well, thank you so much, Lydia, for sharing your wisdom and experience to empower parents to just step into the healthcare conversations with healthcare professionals with clarity and, most of all, with confidence. And moms who are listening, remember that you don't have to be a medical expert to protect your child. You just need the right tools and the courage to ask the questions and speak up and stay engaged, which is something Lydia has talked about throughout our conversation. And if you want to learn more about the ACE method or you want to connect with Lydia directly, be sure, as she said, to visit healthcarenavigator.com. And don't wait for a crisis. Start building your healthcare advocacy skills right now because your voice matters and your child's safety absolutely depends on it. So if we shared something today that you can use right now, I want you to drop it in the chat. Tell us what you took away from this conversation. And if there's something we missed, I want you to drop that in the chat too. We want to know. And we want to just make sure that you have the latest and greatest tools as you raise the next generation. And as always, remember, it is never too late to be the parent you want to be. Can't wait to talk to you again next time. Take care. We bring you this episode for the purpose of information and entertainment only. It is not the intent or purpose of the Parenting 411 podcast or Carol Maletta to provide an exhaustive reference or guide on all aspects of parenting, childcare, and family life. You are strongly encouraged to read all available information, consult medical or other appropriate professionals, and pursue all reasonable means to learn as much as possible about parenting to complement what you gain here, and then tailor the information to meet your individual needs. Yes, parenting is a serious matter, though it is not an exact science. The context and insights offered in this and every episode represent an account of knowledge and personal experiences of the host and any featured guests for the viewers' and listeners' information and consideration. The host and guests do not guarantee to our viewers or listeners any specific parenting outcomes from this episode or taking actions described here.